Hi guys, this is Shahul. I'm a resident in Stanley Medical College. Today I just want to share a few of my experiences and thoughts regarding management of COVID-19 infection. Um, and also I will narrate my experience how I came through this COVID infection. Even I was infected and I was positive a week back. And please don't skip this video. This is specifically for budding doctors, for young medical students who are just studying right now. As you people are in half a way to become a doctor, but still you will be considered as a doctor in this pandemic situation. You will get calls, get messages about COVID-19 infection, though you have not completed your degree, though you are not qualified to practice, but still you will be considered as a doctor in this emergency situation. Even a first year or second year doctor is, first or second year medical student is considered a doctor in this situation. So kindly don't skip this video, see till last. Please see till the end of this video. I will tell some of the very salient and very important points regarding the management of COVID-19 infection. Even it is helpful for public people who watch this video. See, initially I just speak few words about the statistics of this infection. Say it affects 100 people. For example, if it affects 100 people, 85% of people fall in one category and remaining 15% of people fall in the other. First, I will speak few words about these 85% of people. This 85% of people come under normal people, like they have perfect health, their age is not extreme, like they are not more than 65 years, they don't have any comorbidities, and they have a perfect health. Most of you people who are watching this video will belong to this category only. For these 85% of people, the COVID comes, it recovers on its own. The symptoms you might experience: fever, sore throat, anosmia, body pain. Very rarely you might also have loose stools and vomiting. So these are the common clinical manifestations of COVID-19 infection for a healthy person. And the time limit is 3 days. By the end of the third day from the onset of symptom, you might feel you are getting well and you will experience the sense of recovery, which means that by the end of third or fourth day, the fever comes down, your symptoms start to settle down. But anosmia might persist for a longer time, but definitely your body pain and your fever settles down. This happens with 85 out of 100% of people, and most of the young adults, young healthy people will get recovered from these symptoms alone. And most of you doctors and most of you people will know how to manage this 85% of people. See, you start with tablet azithromycin, which is an antibiotic, 500 mg once a day, tab zinc or zincovit once a day, tablet paracetamol 650 mg if necessary, and you can also have tablet vitamin C. And these are the common drugs which are being prescribed to every people who is being affected with COVID infection. The reason why you give antibacterial, azithromycin is an antibacterial, but still you give it for people who are affected with virus, which is COVID. The reason is to prevent secondary bacterial infection. When your lung is infected with a virus, it is more prone for the bacteria to come and multiply and cause an infection. And that is the reason why you start on prophylactic azithromycin, so that you don't get any secondary bacterial infection for you. Reason for vitamin C, it promotes wound healing. During COVID-19 infection, your lung might get affected and it promotes healing. 3, paracetamol, just to settle your fever, just to suppress your fever. And by the end of the third day, your immune system will start recognizing the antigens, will start recognizing the COVID infection, and it will start to produce antibodies which will kill the virus, and your symptoms will come down by the end of third day. So this is the common protocol. You might know, everyone would know, even the common public knows about how to manage these 85% of the population. But the problem comes with this 15% of population. 15% of population, these populations are those who have extremes of age, like more than 65, who have comorbidities with uncontrolled sugar, and who have cardiovascular risk factors, or in some other comorbidities like chronic kidney diseases, patients on immunosuppressive drugs, HIV, and so on, in which your immune system is compromised. So what happens in this 15% of people? Let's come to it and let's see the management. In this 15% of people, the virus goes and multiplies inside, because due to lack of this immune system in our body, it starts to multiply massively. Those people don't have a proper immune system to combat the virus, so the virus starts to multiply, and the remaining immune system, like the unformed or defective immune system, consider that to be very serious, and it will start to produce antibodies and cytokines and inflammatory mediators more than which is required, which leads to inflammation and even damage to the tissues of the lung. So I will come to the physiology of it. What happens in this, I will come to the physiology, what happens in this 15% of people, and then I will speak about the clinical features followed by management. Please don't skip this video. Actually, the initial part which I have spoken till now is not that important. Mostly you might be knowing, but this point, what I'm going to tell you right now, you might not know. And if you know these points, there are increased chances that you might save even hundreds of people. Please don't skip this video. Don't skip these points. If you would really want to, keep it inside your mind, you can even take notes on what I'm going to say right now. See what happens in this 15% of population. The virus comes and it multiplies massively, and the immune system considers something to be very great, and it starts to produce cytokines at a very high rate. This the very most important and specific cytokine like interleukin which is involved is interleukin 6. So what happens is the body becomes hyperimmune. It secretes a lot of interleukin 6. It secretes a lot of inflammatory factors. And from the Robbins book, you would know that inflammation itself is a prothrombotic state. So what happens is our immune system produces antibodies, and these antibodies are said to have molecular mimicry on the blood vessels, on the endothelial cells of the lung. So the antibodies which are produced against this COVID-19 infection also affects our own endothelial cells which are present in the blood vessels of the lung. So it goes and affects the endothelial cells, making it very prone for thrombosis. You know that whenever there is an endothelial injury, then that blood vessel is more prone for thrombosis. Okay, as the immune system comes and it damages the endothelial cells of the lung, that becomes more prone, and there is occurrence and formation of microthrombi inside the blood vessels of the lungs. So when there is thousands and millions of microthrombi inside the lungs, what happens is the blood is not able to flow through the obstructed and thrombosed vessel, leading to decreased perfusion, leading to decrease in saturation. One important physiological concept that every doctor should know is, see, similarly like as it is in the heart, that our heart is just working 30 to 40% and it has 60% of its capability as a reserve. Only when you work fast, when you have intense exercise, your heart's capacity, it consumes its reserves. Exactly likewise the heart, the lungs also functions in the same way. Only 1/3 or half of the lung will be functioning for a normal individual, where the remaining half will be like a reserve. For example, it will work only if you have a very intense exercise, when you run for longer time, you might feel exhausted. At that point of time, the remaining half of the lung works, where normally for an individual, only half of the lung works. Half of the areas get perfused, and only, that half is sufficient for you to maintain your saturation. So what happens in this COVID-19 infection? When this COVID affects, when it affects till it affects half of the lung has a well-known reserve. That is why the lung is able to maintain saturation even after it gets affected, like 40% of, even after 40% of the lung affection, it will show the saturation to be having 98%. But it is not the case. So already half of the lung would have got damaged before the saturation starts to dip down. So how that saturation dips? You have development of immune system, you have development of antibodies which are acting against their own endothelial cells present in the blood vessels of the lung, and it causes prothrombotic state, it causes hyperinflammatory state. You have multiple thrombi with formation inside the blood vessels, so the blood is not able to flow through the lungs. After it affecting 50%, like 40 to 50% of the lungs, you might feel a dip in saturation. This is what is happening. So this endothelial injury is not only occurring in the lungs, it can also occur in the coronary blood vessels, leading to myocardial infarction. It can happen in the brain, causing you stroke. It can even happen in the peripheral vessels, leading to gangrene. See, there are COVID patients who present to you with myocardial infarction. You might get patients with stroke or even gangrene of the foot. The reason is hyperinflammatory state leading to prothrombotic state, leading to clotting of blood vessels. Okay, now I come to the clinical features. How this 15% of very high risk population present to you. The very first important sign is persistence of fever. Remember this point. Normally, for every individuals who are normal, the fever should go by the 3rd or 4th day. If the fever persists continuously for the 5th day, or if there is development of any symptoms like breathlessness, cough, dyspnea, which is persistent or it is aggravating on the 50th day, you need to be super conscious. It is exactly, treating COVID is exactly same like treating an acute myocardial infarction. Time is muscle and muscle is life. Likewise, here, once the antibodies start to affect the lungs, you might experience symptoms like persistent fever, or even the fever might go on the 3rd day, but it can reappear on the 5th day, or you can have onset of symptoms like breathlessness or increased respiratory rate, or you might experience cough which is bouting in nature, which is severe from inside. Whenever you experience this, if you are a medical student, be super conscious. If you are a public who is watching this video, kindly consult a doctor. You are getting into that 15% high risk individuals. You are one among those 15% individuals who can even endanger their life if they don't have a proper treatment at appropriate time. What happens is, the reason why you have this persistence fever or persistence of symptom is because of these cytokines. We call it to be having cytokine shower. Initially, the body produces excess amount of cytokines, which is the reason for the persistence of symptoms or even onset of new symptoms on day 5. Day 5 is very, very, very important. It is exactly like window period for heart test, like 12 hours. It is exactly for the window period is 5 days. After 5 days, you need to intervene very promptly. So what should you do? Whenever you have persistence of symptom more than on the 5th day or even after 5 days, whenever you have any of the things which I have mentioned you, kindly consult a doctor. If you are a medical student, if someone asks you that like I have this problem or symptoms, don't ask them to check the saturation. I'm repeating it once again. Don't ask them to check the saturation. Get satisfied by seeing the saturation be having 98%. If the fever persists, which I told you before, only after 2/3 of the involvement of lung, the saturation will decrease. Till then, the saturation will maintain. Till then, remaining half of the lung will take care of its duty, to maintain saturation. So don't get satisfied with like, okay, I'm having saturation of 98. There is no need for me to go and consult a doctor. There is no need, we can wait and watch. No, it's not the case. COVID, like this second wave is causing more than respiratory problem. It is causing thrombotic effects. It is having thrombotic manifestation. That is what concerning a lot of doctors now. People die not because of COVID infection, not because of inappropriate treatment. It is because of the late presentation of these symptoms. People bring in the patient only after 8 days of the onset of symptom, only after 10 days of the onset of symptom. People bring in only after the saturation dropping like 90 or 80. See, by the time when you bring the patient, when his saturation is 80%, even 90%, more than 2/3 of the lung would have got, infected, like would have got inflamed, and cytokine would have destroyed more than 2/3 of the lung. It is very difficult for us to manage at that point of situation. So make sure that you go and consult a doctor at appropriate time. On the 5th day, take a CT. If you have persistence of symptom, things which you need to do: number 1, take a CT and check for the involvement of lungs. Number 2, go and give blood tests. The blood tests to be given are interleukin 6, D-dimer, ESR, CRP, LDH. If you have any doubt, please kindly note it. I'm repeating once again. It is interleukin 6, ESR, D-dimer, CRP, LDH values, and CBC. See, if your body is in a hyperinflammatory state, definitely levels of interleukin 6 will be skyrocketing. If you have a prothrombotic state, levels of D-dimer will be skyrocketing. If you have any inflammatory state, acute inflammatory reactants like C-reactive protein and LDH will be high. So whenever these reports come to be high, or when you feel, when the report of lung involvement is there, like 50% involvement, 40%, kindly confirm it with, consult a doctor, or even admit them. But still you can see that the saturation will be having 98. Please don't get satisfied with 98% of saturation. It is not the real marker of the severity of the disease. The real marker is involvement of lung. The real marker is persistence of symptom. The real marker is elevating levels of interleukins. Real marker is elevating level of D-dimer. See, exactly, I'm comparing this with myocardial infarction. Exactly, you know the role of fibrinolytics in a myocardial infarction. You know the role of streptokinase. You know the role of reteplase in a person to be having acute STEMI. See, you can save the life of the patient if you thrombolyze the patient, or you will lose the patient. It is exactly the same scenario here. If you give them steroids, he will survive. If you don't give them steroids, he will go into a very poor prognostic state. So timely intervention and timely administration of steroids play a vital role. What does steroids do? They decrease inflammation. They decrease the level of cytokines. They decrease the level of interleukin 6. By doing so, it prevents the injury to the lung. And second life-saving drugs, heparin, either heparin or better that low molecular heavyweight heparin, which is commonly sold as enoxaparin. So what does this enoxaparin do? So whenever you feel like there is an elevated level of D-dimer, which is the body's like already the body has started forming microthrombi inside your lungs. And what is D-dimer? It is just the breakdown products of your microthrombi, which means whenever you have elevated D-dimer, which means there are thousands of clots that is already forming inside your lungs. Please don't be lethargic whenever you have increased D-dimer value. Whenever you have increased D-dimer, either consult a doctor, or if you are a doctor, at least start him on low molecular weight heparin. Start him on heparin. It saves your life. It saves your lung. It saves from thousands of microthrombi which is forming inside your lung and blood vessels. So start, if you are a doctor, please start him on steroids. The best steroids, as far as known from the research, is methylprednisolone. You can give it orally, based on severity of patient, you can even give IV. For oral, start with 16 mg OD of methylprednisolone. If it is IV, start with 1 mg per kilogram OD. Mostly adults will be 60 kg. So the dose of IV methylprednisolone will be 16 mg per day. You can give it in a BD dose, 30 mg in the morning and 30 mg in the night. You can give it as a BD dose. Start him on enoxaparin. It is a OD dose. So based on severity, you can also give it on BD, but mainly enoxaparin for COVID patient is given OD. It is 40 mg given in the morning, OD dose. It saves your life. Enoxaparin prevents from forming further microthrombi. Steroids prevents from interleukins to causing deleterious damages to the lung tissue. So steroids and heparin is a life-saving drugs in severe late COVID patients. Don't consider persistent of symptom of on the 5th day persistent of these symptoms as a lethargic one. It is very serious. Okay. Make sure that you either admit him or start him. Even if you don't have access to hospital beds, if you don't have facilities to hospital, at least consult any one of the doctors through phone and start steroids. If you are a medical student, and most of my videos are being watched by medicals, if you are a medical student, please consult your seniors and start them on steroids. Start them on low molecular weight heparin. Don't wait. I'm telling you. See, if you leave on day 5, 25% of the lungs would have been affected on day 6. 50% of the lungs would have been affected on day 7. I'm once again repeating, it's like exactly like myocardial infarction. If you leave on that moment, you will lose the patient. It's like exactly, see, I'm like, that, see, just by the next second, what happens in the myocardial, like blocked arteries, blocked coronary arteries, the heart muscle will start to die. It is exactly the same condition that is happening in the lungs. Okay, microthrombi forms, there are lots of microthrombi which is destroying the lungs further, inflammatory markers destroying the lungs further, and the lungs is going in for deterioration. The only drugs which can, the marvel and novel drugs which can stop these progressions of lung injury are steroids, number 1, and heparin, number 2. Don't be silly, don't be lethargic. Please treat, you're a doctor. If anyone calls you and like asks you that I am having fever but it is not settled, it has not settled, it is day 5, one important thing I want to stress upon. Mostly people will tell you wrong dates of onset of symptom. When you ask from when did the fever start, they will tell you that fever started yesterday, but the symptom of sore throat would have been 2 days before. Then the onset of symptoms will be 3 days. They would have mild myalgia 4 days before, but then they would have got fever only on today, which means the onset of fever is not like the onset of symptom is not day 1, it is day 4, which means you have to start steroids on day 5 if the symptoms persist. I'm not overemphasizing it. I'm just telling you the fact. Don't be lethargic. I came to know that 99% of COVID mortality is not because of improper treatment. It is only because of late presentation of COVID patient. They bring in the COVID patient only if the saturation drops. They bring in the COVID patients only if the respiratory rate is too high. Only they feel breathless, they come to you. By the time when they come to us, when we take CT and we see that the lung is already majority involved, and it becomes difficult for us to save those patients. If they have brought us on day 5, we would have started them on steroids, which would have prevented its progression, which would have prevented its thrombi formation, which would have prevented this MI. So please be conscious, student. Even I got affected with COVID, and alhamdulillah, because of this vaccination and all these things, I recovered from it completely. But my relatives, and they are falling sick, please pray for them. Okay, this is what I wanted to share on this occasion. Please be serious. People emphasize on putting masks, people emphasize on self-isolation, but most of the people don't speak about the treatment. See, exactly like, if COVID is becoming a very common condition, that even the treatment part, every public should know. Even the treatment part, they should know the timely interval. They should know the importance of the timely interval of this disease. Now, COVID is everywhere. No, it's not that useful to, to say to people about masks, about overemphasizing on prevention. Now we need to start focusing on treatment, because COVID is everywhere. Everyone invariably is affected with COVID. So every medical student should know about the management of COVID. So please be serious, guys. That's all. Thank you.